Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. A very good morning, everybody. And hopefully Ramadan is treating you guys and your families and loved ones very beautifully. I'm thoroughly enjoying this month. I've had a chance to sit down with my two teenage boys, which sometimes becomes very difficult because they like to eat at certain times and eat in their room. And so this month is a time for family, and we all sit around the table, and your focus just kind of changes, and I find it extremely beautiful. I've always looked forward to this month. So I hope it's the same for all of you out there. Today I want to talk about teeth sensitivity, which can occur when you consume hot, cold, sweet, or sour foods and drinks, or even by breathing cold air. Pain can be sharp, sudden, and shoot deep into tooth nerve endings. If you've had teeth sensitivity, you know what I'm talking about. For many people, they say it's worse than childbirth. I don't know how, but that's what they say. Treatments include whether you use fluoride or hydroxyapatite, desensitizing toothpaste, and dental bonding. So teeth sensitivity usually occurs when the underlying layer of your tooth, the dentin, becomes exposed. So remember, again, we have the outer layer, which is the enamel. The second layer is the dentin, and the third layer is the pulp, the nerve. This can happen due to erosion, which is wear and tear, and gum recession, when your gum tissue pulls away from your teeth, exposing the roots. So for many of you, during my examination, you might hear me say you need to have facials on tooth number XYZ. Basically, it's just meaning that your gum has moved away and your root is exposed. So how do I do this? I fill it with tooth-colored filling, and it does two things. It makes it a lot more aesthetic because the root is yellow, and I should say it's very functional because I take away the sensitivity. So teeth roots, which aren't covered by hard enamel, contain thousands of tiny tubules leading to your tooth center, the pulp. These dentinal tubules or channels allow stimuli, for example, the hot, the cold, or sweet food, to reach the nerve in your tooth, which results in the pain you feel. Dental sensitivity can also be a symptom of other issues, including cavities, gum disease, or a cracked tooth. Many factors can lead to the development of sensitive teeth, including brushing too hard. This is first thing we talk about with everyone is how do you brush and what kind of toothbrush do you use? Over time, brushing too hard or using a hard bristled toothbrush can wear down enamel and cause the dentin to be exposed. It can also cause gum recession when your gum tissue pulls away from your teeth. So back to gum recession. Some people are genetically prone to thin gum tissue. Other people develop gum recession as a result of periodontal disease, which is bone loss, because gum follows bone. So if you lose bone, the gum will follow it. With gum recession, your gum tissue pulls away from your teeth, exposing your roots. Then there's gum disease, which is inflamed and sore gum tissue, may cause sensitivity because of the loss of supporting ligaments, which exposes the root surface that leads directly to the nerve of the tooth. Cracked teeth. Chipped or broken teeth may fill with bacteria from plaque and enter the pulp, causing inflammation. And if there's a crack, many of you say to me, I have sensitivity to both biting and to cold. And that's one of the hardest things for dentists to find out where exactly is the crack and how deep is it. Unless it's huge, it doesn't show on the x-ray. So we have, a bunch of tools, and it's really from experience. But once we open the tooth, or by looking at it, we know where the crack is. If it's more superficial, sometimes just with bonding, it works. Otherwise, I recommend placing a porcelain filling, because that porcelain filling is bonded to the tooth. So every time you bite, basically what happens is the crack opens up and that causes pain. So this bonding doesn't allow for that. And if it's bigger than just, a filling can handle, then I tell people we need to house it. We need to put a home over it, which is a crown. And then the last case scenario is if the crack has gone through the roots, if it's still savable, then root canal would be the last resort. Teeth grinding. Grinding or clenching your teeth may wear down the enamel and expose underlying dentin. So for those of you that are grinders, you notice your teeth are turning more yellow at the tips of them. It's because you've grinded away your enamel and now the dentin is exposed and it's causing sensitivity. And you also always hear me say, by grinding, you're just awakening the nerve of your teeth. Teeth whitening products. These products are major contributors to teeth sensitivity. If you want to brighten your smile, talk to a dentist about teeth whitening for sensitive teeth. My last podcast, I went in quite detail about different options of whitening and pros and cons. I suggest you listen to that. And teeth sensitivity is highest between the ages of 25 and 30, because as we age, the nerve recesses, gets smaller, pulls away, we can say. So that's the one good thing about aging. So in general, we have less sensitivity. The presence of plaque on root surfaces can cause sensitivity. Because remember, plaque is just basically the food that we put in our mouth plus the bacteria that already exists creates this acidic product, which is the plaque. And it's acidic, so as it stays on the teeth, it demineralizes the tooth surface and it causes sensitivity. Some over-the-counter mouthwashes contains acids that can worsen teeth sensitivity if you have exposed dentin, the middle layer of the tooth. The acids further damage the dentin layer of the tooth. If you have dental sensitivity, ask your dentist about the use of neutral fluoride or hydroxyapatite solutions. Acidic foods. Regular consumption of foods with a high acid content, such as citrus fruits, tomatoes, pickles, and tea, can cause enamel erosion. And my favorite, sparkling water. And I think most of you out there love your sparkling water with a bit of lemon, slice of lemon or lime. That's actually quite acidic and it's not good for our teeth or for our bodies, but that's a topic for a different day. And recent dental procedures. So people can get sensitive teeth after fillings, teeth cleanings, and dental restoration placement. Sensitivity caused by dental procedures is usually temporary and usually disappears in 4 to 6 weeks. If it's sensitive to cold, it's reversible. And whenever I do fillings, whether small or big, I tell people, depending on everybody's body, everybody, has a different pain tolerance. But if you have sensitivity to cold, that's normal. Again, for 4 to 6 weeks, not more than that. But if you have sensitivity to biting, it means there's a high spot. And as many of you know, I go through a lot of these articulating papers. I call them tap, tap, taps, because I don't want you guys to come back for sensitivity of the same tooth I've done. So especially when you're numb, I have you sit up and we do several of these to try to get all the high spots, because that's one that for sure, if there's a high spot left behind on the filling, on the composite filling, you will get sensitivity, but that's to bite. Now, does sensitive teeth means you have infection? No, not always. Sometimes teeth sensitivity indicates tooth erosion, which is the wear and tear, or gum recession. But it can also mean that you have a cracked or infected tooth. Infection-related tooth pain may be dull and achy, or sharp and throbbing. If you have severe teeth sensitivity that doesn't go away, please call your dentist. But in general, I can tell you, if it's a sharp pain and it doesn't last, that's usually reversible. If it's a dull, lingering pain, it can mean that it's nerve. And if it's to sweets, it's usually a cavity. So this is the guideline that I use. Sensitive teeth pain can go away. In some cases, teeth sensitivity goes away on its own, especially if it's due to a recent dental procedure, such as a filling or even root canal. So after a root canal, there's a great chance you'll still be sensitive. It doesn't mean that the root canal was bad. It's just because we were in there and, all the treatment that was done. And so everything needs a bit of patience, you guys, and a bit of time. Treatment depends on the cause. If you develop lingering teeth sensitivity or discomfort, be sure to schedule an appointment. They'll need to rule out any serious conditions so they can recommend appropriate treatment. To reduce your risk of teeth sensitivity caused by normal wear and tear, use desensitizing toothpaste. There are several brands of toothpaste for sensitive teeth. With regular use, you should notice a decrease in sensitivity. You may need to try several different brands to find the product that works best for you. Spread a thin layer of the toothpaste on the exposed tooth root with your finger or a Q-tip before going to bed. I love saying this one to patients. I say before you go to sleep, just that area that you feel sensitive, put a bit of your desensitizing toothpaste and go to bed. And it can have fluoride in it or hydroxyapatite, as your choice. We can also make customized trays, by the way. And for those of you that do like fluoride, you can place the fluoride in the tray and it just stays on the teeth. So there's customized trays for that. And then there's desensitizing agents that we as dentists have that we place directly on the teeth. It's not a filling, it's just a thin layer, and that helps a lot. But believe me, if you try your toothpaste, and remember, this should not be a whitening toothpaste or anything but a proper basic toothpaste with hydroxyapatite again, or fluoride as your preference. That will help with your sensitivity. And of course, maintain good oral hygiene above everything else. So continue to follow your proper brushing and flossing techniques to thoroughly clean all parts of your teeth and mouth. And then I have to say, make sure you come see your hygienist and dentist every 6 months, biannually. Use a soft bristled toothbrush. This will result in less toothbrush abrasion to the tooth surface and less irritation to your gums, and make sure your technique is correct. So that again is a reminder for you to see your hygienist to make sure you're using your proper brushing techniques. And watch what you eat. Frequent consumption of highly acidic foods can gradually dissolve tooth enamel and lead to dentin exposure. They may also aggravate the sensitivity and start the pain reaction. So remember, the chocolates, the sweets, all of that, it's not about how much you eat, but in how many times a day you eat it. Because every time, think of it as an acid attack. So I'd rather you eat it once, wait 20 minutes, brush your teeth, and then that's all you have for the rest of the day, if you're one of those that needs to have it daily. Daily use, again, of a hydroxyapatite or fluoridated mouth rinse can decrease sensitivity. And so many grinders out there now. If you grind or clench your teeth, use a mouth guard. It's the best preventative measure we have. And in reality, there is an expense to night guards, but I always tell patients, if you crack your tooth, if you need a crown, if you need fillings, the cost accrues so much more than a night guard. And why go through all that being in the dentist's chair if you can just slip on that night guard before going to sleep? Schedule an appointment with your dentist if you have teeth sensitivity to cold, which again could be just right after you've had fillings and that will go away. Or it means you have exposed roots, which are those facials I talk about. We just cover the roots. Heat usually means a nerve, so that we have some tests that we have to do. And sweets, because most likely there's cavities. In summary, several different factors can cause teeth sensitivity, including worn enamel, exposed roots, cavities, cracks, and even recent dental procedures. Whether you need treatment depends on the cause. You can address mildly sensitive teeth with desensitizing toothpaste and good oral hygiene. Severe teeth sensitivity caused by gum recession, cavities, or cracked teeth may require more treatment. Your dentist can help determine what's causing your sensitive teeth and recommend the best treatment to address your issue. Thank you for listening. to our Ask Dr. Leila podcast. May you have a wonderful week ahead and talk to you guys all soon.